Hi, my name is Maria Elena Cisneros. Today I'll be explaining a little bit on good patient communication and patient visit. We will start off by welcoming the patient to our office. We will start by registering the patient, gathering any information needed, such as insurance, copy of ID, or write down any new concerns they might have, or any new medication that they might be taking. Then the medical assistant would go and check the examine room, making sure it's clean and it's restocked. Once the medical assistant has done that, the medical assistant will call the patient back to the office, where we will take the patient's vital signs that include the temperature, respirations, pulse, blood pressure, height, and weight. We will also ask the patient what is the reason they're visiting the office today. Once we have all that information, we will take the patient to the examination room and ask if any information that will be discussed today, if they give the consent for the doctor or for the medical assistant to speak about it in front of a family member, if there's a family member present while they're being examined. Once the doctor has seen the patient, and if the doctor orders any medication or treatment for the patient, I will ensure the patient understood the procedure and have the patient repeat the steps I explained to them back to me, making sure that they understood how to take the medication and if they understood the treatment that was given to them, or if they understood how to do a certain procedure at their home. I will also ensure that the family member that is present understands the process for the treatment or the process to take the medication, especially if the family member is caring for the patient. If the patient needs help finding any community resources for which they may be eligible, I would provide the patient as well as their family with pamphlets with information on the research in which they would like to know. Some communication barriers I believe could exist between patient and healthcare workers is the gender difference between the medical assistant and the patients. Also, the medical assistant being unable to communicate correctly with the patient, a hectic environment, and patient having any discomfort or the patient being in pain. A medical assistant could have good communication skills with patient family members by taking into consideration what the patient's loved ones is saying, taking in not only the words but also the visual clues from their facial expressions or body language. Good listening skills involves making eye contact and respecting the patient's personal space. By AMA improving their listening skills, it will allow them to better communicate with patients and their colleagues.